Hi, my name is Alexis Clauser. I'm an environmental health specialist at the Arkansas Department of Health, and today we're going to be talking about the importance of pediatric vaccination. I know this is an important topic to everyone in the audience, as you are all mothers, and this topic is close to your heart because you all have children, and we all want our children to be the safest possible and to live happy, long lives. So we're going to discuss today the importance of vaccination. So vaccines have a long history, and they have a history that is even longer than what's recorded on these slides. So we have records of people and doctors administering inoculation to patients really far back in history. But the first one that we're going to talk about today is the smallpox vaccination in 1796. This was a really important breakthrough in public health and in medicine because it was one of the first successful recorded vaccines. And then we have the creation of the MMR, measles, mumps, and rubella vaccine in 1971, which has completely changed the safety of our communities, and it's allowed our children to go to school safely without fear of contracting an illness that could potentially kill them. And finally, one of the greatest successes in public health and medicine was the eradication of polio through vaccination. It only took 6 years to eradicate polio, and that was likely due to successful vaccination. There was a large uptake in vaccinating children with polio, and that allowed the disease to be eradicated. Vaccines are very important because they help control the spread of disease, they help to further antimicrobial resistance, and lastly, they help to limit the number of children who get deathly ill. If these illnesses are contracted while vaccinated, oftentimes it won't escalate to the point of severe illness or even death. But without the vaccines, there's a higher likelihood that children can experience a really devastating version of these illnesses. So now we're going to address some concerns and misinformation surrounding vaccines. So almost as long as vaccines have existed, there's been misinformation, and then there's been vaccine hesitancy. So one of the more well-known instances of misinformation was the Wakefield case studies, and these proved to be very dangerous because they made people skeptical about vaccinating their children. He speculated that vaccines caused autism, which was later disproved by the American Academy of Pediatrics, and they published a 21-page paper with extensive evidence and data that showed that vaccines were incredibly safe, including the MMR vaccine. And Dr. Wakefield's license was revoked after they found out that he was spreading that misinformation. And although it may have only been one or a couple case series, it really proved to be dangerous to many people who were then skeptical about vaccinating their children. And talking about vaccine effectiveness, so effectiveness measures how well a vaccine improves the health of communities as a whole. The higher percentage of vaccinated people within a community, the more likely that community is to develop immunity. And vaccines approved by the FDA are safe and effective. So it's important that children are vaccinated against things that can protect not only them, but their communities as well. And lastly, here are my references. So this is just an abbreviation of the full presentation, but I will be giving a more extensive presentation at the end of this semester. So thank you all for listening, and I look forward to speaking with you again.